Live is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
Thanks for watching Afternoon Live. It's a diagnosis no one wants to get, finding out that you have a brain tumor. But Providence has a program to give brain tumor patients help to explore all their options. We welcome neurosurgeon Dr. Pankaj Gore from the Providence Brain and Spine Institute to talk about their brain tumor second opinion program. Dr. Gore, thanks for joining us.
Thanks, Kara, for having me.
I can't imagine what this news would be like, but what do you see a patient going through when you have to deliver the news that they have a brain tumor?
You know, it can be a very scary diagnosis. Some tumors are small, really insignificant, don't change, benign. We don't have to worry about them. Other tumors can be life-changing, but the uncertainty is very taxing on patients. And so, you know, being able to give them more information about the management plan, treatment options, and how to proceed is, you know, I think reassures patients that there is a path forward.
Now, you have the brain tumor second opinion program because oftentimes someone is diagnosed at another hospital or clinic. So when they come to you, what is something that they are almost relieved that they have a second opinion for?
I think more information never hurts. I also think when someone first gets that diagnosis, you can almost you know, blank out and not process anything that you're getting during your initial consultation. And then just meeting with other experts in the field also gives one the opportunity to feel more comfortable with the treatment plan, you know, discuss options. Even if I had a medical condition myself, I would always get a couple opinions just to see, you know, what I thought the best path forward was.
Now, when did this program start?
So we've been working on this for probably 5 years or more, and we were about to launch right before the pandemic. And then oddly with the pandemic, actually, you know, the virtual visit technology became much more widespread and patients are much more comfortable using it too. And it was one of the core elements of our platform. So it's really allowed us to provide those services all across Oregon and also into Southern Washington.
And what have you seen when people come in with that first diagnosis? How often is it something different? Have you seen something different going on?
Often we're able to at least have a couple options in terms of what's going on. With some tumors, you don't know what the diagnosis is unless, you know, we do a biopsy or the surgery for the tumor. But we're able to discuss the different options that the tumor could be, what the different surgical treatments potentially are, and what then the post-surgical options are as well afterwards.
Yeah, even if it is the same diagnosis, does it give a patient relief to get that second opinion?
I think it does. It's particularly with the less common tumors or the more challenging tumors, it helps them to talk to other experts in the field and feel confident with their treatment plan. And often they will feel comfortable with the expertise we offer them and come have their care here at Providence.
Now, what is that follow-up step? I know it probably depends on what you're seeing, but is it common that you come in for that second opinion and there's certain tests that you're doing?
Yeah, so typically patients access us through the website, and it's the virtual second opinion through the Providence Brain Tumor Program. And then there is a care coordinator who takes it from there and gathers the information, is constantly touching base with the patient and arranges a visit with us within about 7 to 10 days. And then the next step just depends on our consultation. At times, if it's just informational, the patient will go back to their original provider. If the patient wants to pursue care here, then we have them come in for an in-office visit. If there's additional imaging needed, then we order that.
But it sounds like with that care provider giving them some emotional support too, which is really great. Dr. Gore, thank you so much.
It's my pleasure. Thanks for having me on.
Yes, and we'll have more information about Providence Brain and Spine Institute on our website at KATU.com. And if you'd like to make an appointment, the phone number is right there, 503-216-1055. And don't go away. We'll be right back with more Afternoon Live right after this.